Hi everyone, my name is Shruti and I'm part of Team 33 where we have created the gamified recovery monitoring app for stroke patients who are in the modified ranking scale of 2, 3 and 4. Our app's name is HealQuest where we have created different games which test out different skills for our patients such as cognitive skills, motor skills and vocal games. We plan to do this in order to decrease prolonged hospital stays and free up the beds for more critical patients. And we plan to start this game when the patients are in the hospital and then slowly transition them as they get discharged and continue tracking their progress for the providers. So the app we created is present here. This has two basic views. One is the patient portal and the other is the provider healthcare portal. When we go into the patient portal, we see the first is the difficulty level where the patient can choose. We'll have much more levels based on that MRN scale, sorry, MRS. MR scale, which is the modified ranking scale. But currently, if we go with beginners, we see different games such as emoji imitate, mirror emotion, which is for again motor skill, a memory game for them to see a pattern match and calculate numbers. For example, once the memorization period is done, the patient can go and flip cards to match the numbers. For example, 3 and 1 that doesn't match, so we go back and match. And this tries to identify his cognition levels, and we get a score back. So we can go back to a game and play a different game, such as repeat a sequence, where we test out their voice recognition and articulation and slurs and how they improve their speech as they go on. For example, here they will have to read out the sentence, the water is wet, and record themselves, and it comes up with the speech. For example, if we say water is wet, and it's correct. Let's go. I did it. So in our next game, we are going to track patient's motor skills. So at the start of it, a patient can choose which arm or leg they would like to work on and choose a difficulty level. Right now, I have chosen to work on my right arm at level easy, and we it's a pretty simple game where the patient needs to just follow the stick figure on the lower right hand of the screen, and on the top you can see that we are analyzing the form in which they're doing each of the exercises. Right now we are just testing the shoulder motor skills. Similar to this, we can test out different joints, such as right now I would check my elbow and my wrist mobility as well. So using all these different exercises, we will come up with a matrix which will allow us to analyze a cumulative function of the motor skills. We plan to separate that into lower and upper levels and use the Fugmeyer assessment to analyze how well a person's motor skills. Can go back to the menu again. So I would like to also show you the healthcare provider portal. So if you go here, we get a dashboard for each provider. Like for our provider right now, there are 5 total patients, 1 in critical, 2 improving, and 2 who are ready to discharge with our app. And we also track the patient's progress, like the recovery progress, which will basically be calculated on various factors such as the modified Rankin scale, how they have transitioned, how quickly they have transitioned. Along with that, for motor skills, we would also plan to use the Fugmeyer assessment to see the lower upper body motor skills, along with the joint pains or sensation, to calculate that score and see how they move in that aspect. Yeah, thank you.